He is calling on government to take urgent action to deal with the mental health crisis in the country. It's emerged that of the 6.5 million South Africans who need help, only about 20,000 get it. It came out in a reply to a question in Parliament from the party. So let's get more from DA MP Michelle Clark. Michelle, thank you so much for your time and good morning to you. I mean, the ratio that we're seeing in terms of the number of people in South Africa in need of professional mental health assistance and intervention, you know, that number compared to the number of beds that we have in our current public and private health institutions, what does it tell us about where the gap lies?
Good morning and good morning to your viewers, and thank you for having me on your show. Look, I mean, I'm a firm believer that if you want to see what's going on, you go to hospitals and you visit them on the ground just to see what's happening. And this is what prompted me in submitting these questions to the minister, because I had witnessed really horrific situations in terms of mental health care within our public service health care, to an extent where the units are all capacitated, and that people that are suffering from mental health care are actually put into every ward where there's a bed open, and even into casualty wards, which is not ideal because people with mental health illnesses need to have special treatment and special care. And so I submitted these questions to the minister. And of course, as you can see, only 0.3% of people that are of need of mental health care in this country are able to get that kind of health care. So the situation is really dire. And, you know, at this stage, our public healthcare services in South Africa is really on life support. And I think there's a variation of things that cause this, and that is the will to implement policy properly. We need, you know, skilling doctors and nurses in order to deal with mental health care. There's 451 psychologists that are appointed in the public health sector, and 187 vacancies. And there's really a need for the public healthcare sector to actually form partnerships with the private healthcare sector in order to address this problem as soon as possible.
Right, Michelle, if I may just jump in there and ask this, because you know we're sort of pressed for time, and in making us, you know, see the picture. What then is the impact on, you know, the mental health patients who are in their numbers in need of this care and also not receiving it at, you know, the capacity that they need to receive it? But also we're seeing on the other hand, you know, obviously, you know, these facilities are short-staffed. There's only 1 or 2 psychologists, or probably you know, a handful for so many people. What's then the impact on both the healthcare provider and the patient in this regard?
Well, the impact on the patients is obviously patients are not receiving their care, and so of course their situation becomes a lot worse. I mean, you just have to look at the stats in terms of the suicidal rate in Gauteng itself has increased by 90% by the end of 2021, and that just shows you the impact it has on patients like that. And of course, you know, in terms of the economy in this country, joblessness and various factors in this country is obviously exacerbating mental health care and ensuring that people, you know, fall into a depression and really need that help. So patients are not getting the care they need, and of course the issue has been exacerbated. And then in terms of public healthcare services, you know, it becomes extremely frustrating for medical staff that are not trained adequately and don't have the adequate resources in order to deal with this issue, and having to work around the clock in order to cope with what is happening within state facilities. So their environment becomes extremely strained as well.
Yeah, and just before I let you go, Michelle, I mean, what steps have you taken to ensure that the Department of Health does account and also, you know, provides a plan for intervention?
So I've written a letter to the minister as well as to the chairperson of the health committee to invite the DG, Dr. Nicholas Crisp, to our committee meeting so that we can look how we can strategically address this problem and better healthcare services in terms of mental health care. And really, if we are able to cut back on our medical legal claims, which amounts to the region of this year, 32 billion rand, we could really make a big difference within our healthcare sector in terms of the environment, operational needs, and skilling staff and employing more staff. So there's various issues that need to be addressed so that we can address shortcomings that are critical.
I appreciate you speaking to us this morning. Michelle Clark, DA Shadow Minister of Health, thank you for your time this morning.